As I've been introduced, my name is Leanne Watkins. I'm thrilled to be here this afternoon. I'm taken back many years ago. I'm a lady of a certain age, so this is entirely relevant to me. When I was a management trainee in the fracture clinic, a nurse comes out and announces, I have a pain. And I thought, are they joking because I'm a brand new green trainee? My pain is sat in the back Linda, who I'm sure for many of you nag enormously for the benefit of our patients. But as I said, as a lady of a certain age, and a patient of mine as well, I'm incredibly grateful for that. So really, really great to be here. I'm not going to talk about the clinical model, like there's no way I can do that justice with the experts in the room. But I think this is a really important message for us at a really important time for the NHS in Wales and the NHS in general. Because it is a really powerful, real-life example of how prevention can change outcomes, demand and value. And as a coup, and as a taxpayer, and as a person of Wales, that for me is a holy trilogy. But certainly as a coup or as a chief executive, I think it's really, really important that we've got evidence of when we do this, it delivers the right things for our population and our public. And a lot of this I would just reinforce what's already been said by the various experts through the day. And it's great to be able to come here and I guess sort of summarise it and give a slightly different sort of perspective. But the FLS service represents a transformative approach to addressing fragility fractures within modern healthcare systems. At its core, these services act as a strategic lever that shifts care from reactive to proactive prevention in a relatively short timeline as well, I think, which can be unusual in a prevention agenda. And it also aligns really closely to some broader system goals around population health, sustainability and value-based healthcare. And rather than viewing fractures as isolated incidents, FLS reframes them as events that signal underlying fragility and heighten future risk. And maybe a little bit unusual as a coup, I'm always looking for that next step instead of the reactive is what can I do to prevent that. So this absolutely sings to me around doing something that is much more sort of proactive than reactive. It's really, that perspective I think is critical because it allows us to plan, intervene early and consistently. I think that's another key element for me about the consistency offered to our population, preventing that recurrence and reducing long-term burden, not just on health but on society in general and sort of social care. And from an exec standpoint, FLS provides a unique opportunity to impact on multiple domains simultaneously. Firstly, it enhances patient outcomes, which you'll be very familiar with and we're starting to see. It addresses system efficiency, largely around sort of reducing the unplanned emergency care. Again, holy grail for me, the urgent emergency care sort of environment at the moment. And then I think finally important to say it aligns with current policy direction in terms of community by design and prevention sort of more broadly. And if we can embed FLS and similar sort of systems, leaders can ensure that bone health is not siloed, but instead becomes a driving force in achieving sustainable healthcare outcomes. What is most impressive, I think, from the work that I've seen happening locally, the nag at the back, I'm going to say, is excellent at pulling people together to work across that pathway. Working in silos often doesn't deliver best outcomes for our teams that work in those silos, and definitely not for the patient. So in coming together, that whole system transformation, I think is really, really impressive. And it makes it, frankly, a bit of an easy ask for an executive when you've got a business case sat in front of you that delivers that for you. In terms of some of the challenges I've talked about, we must move away from that fragmentation of care. We must step back and look at that whole person and what we can do to prevent those handoffs between teams. The current, I would say, landscape of fragility fracture, outside of Wales, I'm glad to say, I think is often characterised by fragmentation, inconsistency, missed opportunities for prevention. And in many healthcare systems, patients who experience a fracture receive acute care, but there's no regular or consistent assessment for underlying cause or risk. And that causes a significant gap for them. The root cause of because the root cause is not addressed, it sets the stage for repeat events, which is catastrophic for the individual and also the system that we operate in. The fragmentation leads to variability, with some patients receiving appropriate interventions whilst others fall through the cracks. So that reliability in our system to do what's right for all of our patients, I think, is really key. Another critical issue has been, I think, the reliance on reactive care models, and without proactive case finding, structured follow-up healthcare systems will remain in this cycle of treating complications rather than preventing them. So, what does it deliver in practice? It helps us identify those patients with need. I'm not going to do this justice at all from the experts that have been in the room, so I'm going to skip over this quite quickly and talk about some of the exact sort of leadership and primary care elements. It provides that comprehensive assessment, provides tailored treatment and follow-up, and sort of that integrated care coordination that is so important right across the system. So in terms of impact, out on the outcomes and system performance, it extends beyond patient outcomes to encompass that broader system performance and sustainability. Safety and sustainability are always my two holy grails that I'm looking for in the current role. And clinically, FLS has been associated with significant reductions in secondary fractures, which translates into tangible benefits for patients, including that improved mobility, reduced pain, and enhanced quality of life. Preventing recurrent fractures is particularly important in older populations, where the consequences of such events can be profound. I'm always struck by the impact of the mortality outcomes for patients that receive fractured neck or femurs. And so the ability to influence or limit or mitigate that, I think, is a huge benefit for us. The reduction in demand can help alleviate pressure on our emergency care pathways, and in addition to that, contribute to shorter hospital lengths of stay. Another one of my hobby horses, deconditioning. The shorter the time that people are in a hospital system, the less harm that we do to them. So by reducing the incidence of these events, FLS offers a cost-effective means of improving outcomes whilst controlling expenditure. And beyond immediate savings, the service also supports long-term sustainability by addressing the root cause of demand, and importantly, the benefits of FLS are not only confined to health, they extend across health and social care, families, highlighting the need for that integrated investment and governance. And as I've said already, as an exec, it makes FLS an attractive proposition, as it delivers measurable improvements across multiple domains, whilst aligning with strategic direction. So why have you got an exec stood up here today talking about this? I told you he's a nag, first and foremost, but I actually believe in it. It's a really, really important example of, it's really heartening. There's nothing that gives me greater joy when I've got a clinician knocking on my door, in fact banging it down, frankly, but that's great, that's exactly what I want. To say, I've got a case for you, look how compelling it is. So the importance of that long-term investment, we started off as a pilot, but it was pretty clear early on that the impact and the outcomes that were being delivered even from that pilot made the permanent investment a bit of a no-brainer, really. So I think even beyond that initial sort of pilot, it allows you then to wrap around that multidisciplinary team, really, really important. Plan the workforce that needs to be alongside our patients. There have been issues, I think, with system integration. I think that's a massive challenge for us. How do we share data? How do we connect teams that are really, really busy? But I think coming together for a common purpose and with such compelling outcomes, I think is really important. And then I think sort of really importantly is that performance and risk management sort of element. Leaders have to establish metrics to monitor sort of its progress, and so that you know that that investment is delivering what is required. And the number of times I've been taken into the office to be shown dashboards, the various dashboards, given access to them, so I can check for myself. But I think that we said we did is really important from a credibility perspective. And we're hearing a lot about sustainability in primary care. We've got significant challenges right across our healthcare system, but no more so in primary care. You know, my magic wand would be to deliver a sustainable primary care at the moment, because I think that would help our population best. But the reality is that if we're not careful, we don't liaise carefully with our primary care colleagues, that view that we are shifting work or work to primary care in an unplanned way means that we won't deliver what's best for our patients. But it is really important that in integration with primary and community services, because of the coordination, the understanding of what that patient requires, their own circumstance, and what and frailty sort of services for a holistic patient approach looks like. It reinforces the community by design often, and the care closer to home. I think a key challenge, to be really honest, we haven't solved it yet, is that digital data sharing, you know, one record across the system that everyone knows and sort of understands. And the reality is primary care is where the value is sustained in the long term. Call to action, really, really important that we have an advanced model of integrated bone health going forward. I know many of you, or some of you, are still, having listened to some of the chat over the break, looking to develop your business case, but we must look ahead and plan ahead and come together to really drive forward an agenda that's very important for our population. We must have a holistic bone health approach so that the evolution from standalone programs to fully integrated components of advanced bone health systems are in place. This means that we can incorporate into a broader and wider range of services and interventions, including frailty assessment, falls prevention and patient education. Not only can we address the immediate risk of fractures and the underlying factors, but the underlying factors that contribute to fragility. The closing message for me is that we must do this. It is a preventative healthcare focus. It wouldn't have happened. I have to give a shout out to Linda. I know I've joked about him in that. But his leadership and drive and relentless pursuit of this agenda would not have resulted in us being here today. Certainly not the service that we have in Gwent and the benefits that that's delivered. That I think can be replicated across Wales and the UK, in fact. So I think that leadership and collaboration, you know, my ask of you is to go into your teams, your organisations, spread the word, convince, compel, beat the door down in the same way that India did to get this over the line because of the benefit that it delivers. It is really important because it starts to show what we can deliver in an integrated care model, not just in health, I think with our local authority partners as well. And we must, I think, for the future, look to a digitally enabled, patient-centered FLS model that offers that sustainable and resilient future for all healthcare systems. And I thought that the last sentence speaks for itself. Thank you very much.